you make him the
Yeah.
Yeah.
Yeah, sir. Yeah. Can you people see me?
Yeah, you are visible.
Yeah.
And quite
Very
you are
nice.
looking
Yes.
very fresh.
Yes, very nice. So thank you. Yeah. So friends, I'm Dr. Indranil Bavadekar. This is now the 1791st day of uninterrupted daily webinars presented by International Forum for Promoting Homeopathy. I welcome you all on this Sunday of 27th July 2025. Friends, this International Forum for Promoting Homeopathy is an organization formed to bring together the global promotion of homeopathy and to bring together all the homeopathic movements, activities, and all the activists also worldwide under a single umbrella. The purpose for our IFPH is to concentrate on the field of homeopathy and promote homeopathy. Now, witnessing the present day world, IFPH humbly says that popular, simple, and less expensive medicines are all the homeopathic medicines for the world today, which is relatively different from other systems of medicines, and they are very helpful in defeating today's catosphere. IFPH understands that our mission is to bring and identify to the attention of general public. To fulfill our aims and objectives, we are conducting daily webinar Zoom lectures from September 2020. So for 3 hours daily, these lectures are there. From 7:30 evening to 8:30 evening, we have got a Hindi session, which is over now at present. From 8:30 p.m. to 9:30 p.m., we conduct English sessions, which will be shortly starting now. And from 9:30 to 10:30, we have our own session of a region in regional language, that is Malayalam. So friends, I humbly request you to take it on yourself and become a part of IFPH by cooperating, by joining all these activities. Kindly invite your friends, ask them to join our YouTube channel of International Forum for Promoting Homeopathy, where all the lectures are uploaded almost on daily basis. Do subscribe the channel and do support us. The entire channel and these activities are free of cost. It is only for homeopaths and homeopathic lovers. So friends, by this introduction to our IFPH, I today proceed further. Now today we have got a very good speaker. That our speaker is Dr. Prakash Rao sir. Sir has done his BA PG in rehabilitation. He's done his post-graduation, PhD in homeopathy. He is retired research officer of CCRH Government of India. He has got a very wide experience, which is around 30 years and more. He experienced at CCRH. He works under the project with UNICEF and AIDS Control Society also. He has presented a maximum number of research papers in this IFPH forum. And today his topic for speaking to us, where we will be benefited, will be hypertension and homeopathy. So I humbly request sir to proceed ahead with his talk.
Will be joining shortly. Sir is waiting to join.
Yeah, sir, kindly join us.
No, yes, you can say something about.
Yeah, friends, this hypertension topic is really important, which sir is going to talk upon, because in day-to-day practice, we usually face this problem. Above 40 years, many patients are accidentally diagnosed, or sometimes they are already diagnosed and they come to us for hypertension. And, we only look at the lipid levels. We assure them to, like, sometimes to reduce their allopathic medications. But approach to a case of hypertension in a homeopathic way is really difficult. It requires lots of preparation, ethical approach, good academic studies also, and each case we have to approach in a different way. Some are acute, some are chronic, some are acute on chronic, like Sani sir said. So we, at the present state, we have to diagnose them and we have to manage them. So this topic selected today is very nice, and really we will be very happy to hear the guidelines from sir regarding management of hypertension with homeopathy.
Sir has joined.
Yeah, sir, kindly proceed with your topic of today. Yes, sir, you're audible. You can go ahead, sir.
Can you see my slides, sir?
Yeah, we can see it. We can see the slideshow. No problem, sir. Everything fine on the part of screen. You can go ahead, sir.
Okay, sir. Thank you very much. Sir, today's topic is hypertension. epidemiology, risk factors, and advances in management. See, hypertension is, as the medical technology changes day by day, the understanding of the hypertension, diabetes, and other disorders also will change. The changing medical technology doesn't mean that people are unaware of these conditions, but the research is going on at such a speed that anything that is new will be understood very easily, and whatever we found out the old, that is no way it works out. So day by day, finding out, rather understanding the nature more and more is making more and more technological developments. So the contemporary review of cardiology professionals, the 2024 hypertension is something different from 2025 hypertension. See, we might have read in our books the essential hypertension and the secondary hypertension. The essential hypertension, which we used to call as without any reason, a young person developing hypertension and he will be on medication. But nowadays it is not essential hypertension. It is not deemed as essential hypertension. Now it is deemed as a hypertension with some reason. So the classification of essential hypertension and secondary hypertension has gone. Now the classification is primary hypertension, secondary hypertension. So these are the new developments, and every year it will be going on changing, because as the
Sir, kindly make your screen a full screen. Sorry to interrupt. Can you make it a full screen, your presentation?
yes, sir.
Yeah. Sorry to interrupt you.
No, sir. No, sir.
Okay. Thank you. We can see the full screen now.
Okay.
Yeah.
Now, hypertension. See, everybody, we will see lots of messages that hypertension is so much today, the glucose levels have changed, tomorrow the blood pressure ranges are being changed. No, don't believe that. See, there will be a controlling body. Usually what happens, the research, because Americans will have less diseases, they don't know how to manage the crisis when such COVID epidemic comes. But otherwise, as far as research and funding for research, sometimes what happens, the extraordinary unnecessary research also will be carried out. But we Indians are in need of doctors and need of treating the routine diseases. That's why we will feel odd of research. But it is a developed country, their problems will be entirely different. So their research outcomes also will be entirely different. So the world is going to accept them because they have funding, researching mentality, and researching facilities, which for a country like India, where with 140 crores and meeting the normal diabetic patients or normal hypertension, fevers, simple accidents are sufficient to manage here. So these are some of the things which will make us to surprise whenever the Cardiology Association of America changes its new studies. So now the stages are elevated: stage 1, stage 2. Crisis. Chronic BP elevation damages the organs, which everybody knows, every homeopathy doctor knows, we need not yeah. Over 1.5 billion affected globally in 2023. See, these are the latest statistics. The 2024 statistics have yet to come. High burden in low, middle, and income countries. See what is happening. It is having high burden of the disease like India, Pakistan, Nepal, China, Japan. It is nothing to do with income, because here where we find out the income, see, Japan is also having good income, but that country also equally affected. And China is the second largest economy in the world, but those people are also being affected by the high burden of hypertension. 40 because the accurate count will be present in USA always, because they know each and everybody their statistics management. So 47.7 US adults also suffering from hypertension. See, high burden in low middle income countries and high burden as well as in high income countries. So the income is not the criteria. Hypertension comes with various reasons, and let us go for one by one. And risk factors. There are so many risk factors. Which risk factors? Non-modifiable. Age. We cannot change the age. Age will be going on increasing. As age increases, the hypertension also will be one of the disease that will affect the person. The genetic modification, this is most important thing, that everybody 47.7 all over the globe, or in rich country or poor country, never matters. That is the genetic, the what we call as susceptibility. And ethnicity. Ethnicity means in some of the ethnic group, they will have high cholesterol and they will have high hypertension. Their death rates may be more also. And modifiable, which we can modify, which we can retract, is smoking, obesity, alcohol, stress, diet, physical inactivity. These are all important things to reduce the hypertension or to ameliorate hypertension. Again, I came to causes of risk. Diet. See, usually why diet I am stressing again here is the diet of India or the Indian culture is entirely different from the diet of the Western countries, because here the salt has been identified as one of the tastier thing that will add taste delicious to the food. So there the salt is high salt diet. And salt also, the salt properties were understood by Indians long back. It is one of the best preservatives. So to preserve various things, the salt has been excessively used, and the increased salt also will make the blood pressure to increase. Lack of exercise. Usually exercise and our normal person never goes hand in hand, because everybody in India thinks that their normal way of life or the working, whatever they are doing per day, or walking, or agriculture works, going to office, the stress, everything they will consider as an exercise. But apart from this, one has to concentrate specially on walking for about 40 minutes a day, or minimum of 6,000 steps, so that extraordinary we have to give for maintaining of the hypertension. Diabetes, the other reason, obesity, and usually nowadays the complications of the pregnancy because of the obesity. If the obese woman becomes pregnant, and the late pregnancies are producing hypertension. Cigarette smoking, heavy alcohol use. See, most of the Indians will use more alcohol, and alcohol addicts. Alcohol will be utilized in foreign countries also, but their alcohol will be of minimum, which may help, they will tell. But there also increased use of alcohol as a daily beverages as a daily drinks, that is also making everywhere in the world to get the hypertension. Lack of sleep. Lack of sleep is the reason. The stress. Stress is a condition which is negative. The work which we are doing is not accepted by the consciousness internally, then that will become stress, and that chronic stress became a multi-dimensional habit. For example, I will give you a randomized stress. See, in India, we will accept corruption, giving bribe and taking bribe. So the person who takes the bribe knows that taking the bribe is a sin, and the person who knows who gives the bribe will always curse the person who takes the bribe. But it is socially accepted and they will follow. So such conditions will give the chronic stress, and it will go only when he leaves the job. In the same fashion, the business also. See, cheating has been accepted. See, everywhere we will compromise on such things, and that is going to provide and produce more chronic stress, and more chronic stress ultimately leads into hypertension. Then the cardiovascular diseases according to the age. What happens, particularly hypertension, diabetes, high cholesterol, and heart attacks? As age increases, they will increase. The only difference is, suppose a hypertension and a heart attack. In a patient of 40 to 50 years, there will be a chance of getting hemorrhage in the heart, that is known as stroke, or what you call as the ischemic heart disease will come in the old persons, whereas the cerebral hemorrhage or bursting of the arteries will come at the age of 40. So a person, if he gets coma and heart attack during the young age, that is below 50, there are high chances that he may die with the heart attack. But a person above the age of 70, if he gets heart attack, he will get heart attack only because of ischemic heart disease, not with the hemorrhage or bursting of the coronary arteries. So this is the age. And what are the hypertensions? See, previously it used to be known as essential hypertension. Now it is deemed as a primary hypertension. About 85 to 95% of the cases are coming with primary hypertension. See, clinically, when the investigations are being carried out, it will be known that the clinical evidence will not be present, but the hypertension will be present. And the patient will produce symptoms like palpitations, anxiety, sleeplessness, and sometimes fear, phobia also. The secondary hypertension is due to endocrinal hypothyroidism, diabetes, renal causes, and some of the drugs, the allopathic drugs, particularly antihistamics and corticosteroids. The corticosteroids and antihistamics will increase the hypertension, will make the person very conscious about his stress condition, and they also will predisposes the diabetic condition. So how to diagnose? Via labs, imagining, BP monitoring. Why I am telling labs and imagining? When the BP monitoring is done with BP apparatus, so we have to suspect the cholesterol. When we suspect the cholesterol, we have to see the cholesterol where from it is coming, because of it is fatty liver, or because of the left ventricular hypertrophy, or any pathological changes occurred in that person because of his personality. See, if he is obese, we have to find out so many things. So the most important diagnosis is through the BP apparatus, BP monitoring. Elevated BP, endothelial dysfunction, and leads to left ventricular hypertrophy. See, elevated BP is continuously present for 24 hours in a young person below the age of 40. There will be endothelial dysfunction, such as swelling of the feet and less urination, excess perspiration, and little left ventricular hypertrophy. And if that continues for more than 5 years, there will be mild breathlessness, and it will contribute to heart failure, later to stroke, or chronic kidney disease. Something will happen if it continued more than for 10 years in the body. The age itself, the immunomodulation, the food, everything will control the hypertension. But after certain age, if the disease remains silent in the body, it will contribute to heart failure, stroke, and chronic kidney failure. Link it to metabolic syndrome. What happens when the hypertension is more? Patient will be highly anxious. So difficulty in driving, difficulty, weakness, always want to fatigue, want to sleep, but he never gets sleep. And at the same time, the other metabolic syndromes, putting on weight because of anxiety, are counter medicines. He goes to counter and he purchases medicines and he uses that. Ultimately, without diagnosis, the patient will continue and remain with disease for about 10 years. Ultimately, he lands up with a heart attack and leads to death in some of the cases. So, what is diagnosis? See, office BP. Office BP means when we are acute, when we are ready to go to office, less or more 2 readings. What we have to do during office BP means we have to see at least 2 visits, 2 readings. Then ambulatory. If the 2 readings are more, we cannot see. Diagnosing hypertension is the toughest task, because little anxiety, little worry, because it will be, the hypertension is such a disease. Though disease is present, it will be caused by neurosensory organs, and there won't be any virus or bacteria present, or any fungal infection is present to cause the hypertension. Hypertension is neuromuscular, sorosyphilitic according to homeopathy, and it is just by seeing, by hearing, and all these things will lead a person to develop hypertension. So whenever he is under stress, if he see his pressure, whenever he is worrying, whenever he is anxious, if he see his pressure, it will be more. So we have to continuously monitor the hypertension. Previously, we used to have a ambulatory home monitoring hypertension. See, 24 hours, there will be an ECG machine that will be tied, that will be a small, it will measure only blood pressure. One of the ECG machines, a smallest ambulatory ECG monitoring apparatus. So that will be tied for 24 hours, and the 24 hours it will be going on taking readings. Then after 24 hours, if the hypertension being continued above 140/90, he will be deemed as hypertensive, and to prevent further uh, uh, complications, the patient will be advised to take medicine. Nowadays, emerging technology has developed so much. A digital app, a smart watch, or AI tools, various things are there, various different apparatus are coming to suspect the hypertension in people, and whoever is using these technologies, it is becoming very easy. But despite all these things, clinically to evaluate, to fix that he is a hypertensive, and knowing that the complications of the hypertension, the ambulatory BP monitoring for 24 hours is always advisable, followed by ECG. Then treatment strategies. Usually everybody knows the lifestyle changes. Dash diet. Dash diet means fiber, see, less sodium, less carbohydrates, everything, and walking, exercise, low sodium diet. So these must be followed. First line of drugs, see, these are the allopathic doctors' languages. Why I will take is whether our homeopathic drugs are equally working with allopathy or not. It is our aim to understand as a researcher. So as I am engaged in research, so I will compare always with allopathic drugs, because in technology we have to stand first, and at the same time we have to know our limitations also while utilizing technology. So these are the new drugs which are not useful, and what we have is combination therapy often needed. What is combination therapy? The first drug, ACEI, ARDS, see, they are known as vasodilators, vasoconstrictors, and bundle branch blockers, calcium blockers, chain blockers, various things are there that we need not worry about that. And combination of therapies among their drugs and among with their drugs, our own homeopathic drugs, that is known as integrated system of medicine, where using allopathic drugs will be always leads to complication, and the toxicity of the drugs will come. So to avoid that toxicity and to avoid complications and the side effect of the drugs, nowadays at a higher level, the integrated system of medicine has developed. Using the integrated system of medicine, many benefits are also being elicited. Therefore, the allopathic doctors at the higher level, the scientists at the higher level are also accepting the intermediate medicine or the integrated medical approach. Let us see what happens. So, recent advances, new drugs, SGLT inhibitors, non-steroidal MRA. These all are RNA drugs which will act on RNA. Then renal denervation. See, they will control the blood pressure. At the same time, they will see that kidney should not be failed. So, what complication the patient goes, and before going for such complications, deriving these drugs, and in hurry, a doctor, when he is being trained, there is a possibility that he will give even the renal denervation drugs, and digital BP monitors, AI guided care is must. And nowadays, if he go for treatment to hypertension to any doctor, if he is doing maximum investigations, there is no mistake. But the drug he selected must be useful, and one has to definitely get awareness of the allopathic drugs before taking treatment, and he has to discuss with his physician. Therefore, when such complications are coming, the role of homeopathy is most important, and the integrated system is coming up, and which we control with integrated system. Let us see in our future life. So the prognosis and control rates. Only more or less 25% have controlled BP. See, despite of using the medicines, patient never stops eating food. He never controls salt-free diet. He never maintains the salt-free diet. He never maintains the exercise. And his appetite will be more. He will be around 35 to 45 years of age, where he likes to eat. And when he is having only BP, hypertension, he definitely will enjoy the other foods. So, despite of giving the drugs, whether it is allopathy or homeopathy, the percentage of controlled with the drugs are only 25% of the patients. Rest of all the patients will have higher values of hypertension, which will make their heart to enlarge or may lead to complication. Till the complication comes, patient never be serious. So creating awareness, educating the patient about the hypertension and its complications is most important. This will come under poor control, the higher CV and morbidity and mortality. So these are the results. So despite of creating awareness, most of the people know, but maintaining diet, maintaining continuing exercise is only increasing 5 years of life and less complications. That is, either there will be neuropathy or there will be power of sexual impotency. Some of the complications are bound to come with hypertension, and nobody can stop the hypertension complications despite of managing a hypertension in any systematic way. There are two disease conditions, the diabetes and hypertension. They will take away the normal life of the human being from their normal living. So one has to extraordinarily live. The body itself will look after. So if one takes medicine, these complications may be delayed for 5 years to 7 years maximum, not more than that. So multidisciplinary care improves the outcome. What is multidisciplinary care? So let us discuss later. Now, let us discuss about mortality. Overall mortality rate of hypertension on its own is 12.7 deaths. See, 12 to 13 people will die out of 10,000 people in India for every year. In the sense, if we treat 1 lakh people of hypertension, means there will be 10 into 12, 120 people will die because of hypertension below the age of 60 with heart stroke or with myocardial infarction or ischemic heart disease. So usually if he gets hypertension is more, people will die with myocardial infarction, where he never gives time even to drug to act. So there will be burst of the coronary arteries and the myocardial infarction will come. Hypertension is also linked to several other top 15 causes of death. See, COPD is the other cause, malignancies are other cause, diabetes complications with hypertension, kidney failure. So there are 15 types of diseases. One is hypertension, first is cancer, second is diabetes, third is hypertension, fourth is kidney failure, fifth is hypothyroidism. Like that the list goes. COPDs. The COPDs is the fourth largest killer of the patients in India. So there are 15 causes that will kill the patients, and out of that, hypertension leads the third place after diabetes. So what we have to take away from this hypertension lesson, the pathophysiology and the changes in ECG. Hypertension is modifiable, but under controlled study. See, one physician who is a qualified physician, whether he is a homeopathic doctor or allopathic doctor, see the lack of knowledge, see blaming the stress, tension, worry, and diet is merely not sufficient. The physician should be a qualified person. He has to create awareness among the patients, and he has to tell the consequences of the diseases When he is young, he is getting hypertension. When he is old, suppose a person above the 60 gets hypertension, what is the range of the life he will develop? See how many days he will survive. If he survives, if the hypertension is not controlled, what are the consequences he is going to develop in the old age? That awareness has to be created so that it will be modifiable. New tools, therapies are always hope. Now, new tools of therapy in 2025 have developed so much that even in allopathy, new drugs are coming, the safest drugs are coming, the CRISPR medicines are coming. Despite all these things, as on 2025 up to the 2024 end, only 25% of the hypertension people are being controlled with the medicines. So rest of all the people are not under control. Some of them will tell, around 10% of the people will tell that they are following diet restrictions and exercise. Despite of that, they are getting the hypertension and they are getting symptoms of vertigo and sleeplessness. There the alternate systems are what you call the intermediate system, or the combined homeopathy will come along with allopathic system of medicine. And early detection, adherence are most key importance. So whenever a patient comes, you kindly examine him. After taking the case record, you go for physical examination, make him to lie down, ask him to take rest for about 2 minutes, and ask him to take a deep breath, then kindly monitor the BP and see the pulsation, see the dorsalis pedis artery also in the foot, so that if there is any damage or if there is any thrombosis or there is any block, why he is getting swelling, whether it is because of sodium retention in the body or because of hypertension or because of some other things, because of smoking, thrombophlebitis. So one has to test the patient after taking the case record. So now this is about the hypertension. Now let us come, see, I discussed about this, the hypertension and everything. As far as pathology, physiology is concerned. Now let us go to homeopathic study. What homeopathy will do and how we can control as an homeopathic doctor. See, homeopathy approach to hypertension, an individualized and integrated perspective. See, the integrated medicine has to be followed. Why, I will tell you one by one. The slide always takes you to there. So, individualized as well as integrative perspective. See, the homeopathic view on hypertension seen as a symptom of internal imbalance. This is absolutely true. What is the physiology of the hypertension or blood pressure? The normal blood pressure is known as BP or blood pressure. What is blood pressure? Blood pressure is a pressure exerted on the vessel wall of the artery is known as blood pressure. So the normal blood pressure is 120/80 at the age of 35 or so. So this will remain around 99%, 98% of the people. So 2% of the people will go that side and this side. I have a patient who is having BP of 60/40. He is still alive and working. We could not find out the genetic, when the DNA test was carried out, it was found that in his family, people with low hypertension will continue to live and he will die at the early age. This was predicted by Jipmer doctors. But he is around 85, still surviving and going on cycle. So these are some of the internal imbalances which will be seen as a symptom in homeopathy. Even in allopathy also it is a symptom. But as they have carried out more research, they are going to understand the complications which we denied. Now we are also accepting the science. So if we understand more and more about the pathology and physiology, our prescription will be more and more better than an allopathic doctor, and the management of the hypertension case will be very easy. The hypertension is increased BP. The BP is pressure exerted on the vessel wall of the artery. Then what is the hypertension? Pressure exerted on vessel wall more than normalcy. that is excess pressure being exerted, the heartbeat will increase because the blood rotates 72 times per minute. The pulse reading will be 72 per minute, but the heart rate will be around 104, 105. And if we check up the BP, the pulse will be controlled by the pacemakers and output of the heart. And when the blood comes, the pulse will be controlled neuromuscularly, but at the same time, the stress on the body, on the artery will be more. When we will see with the monitor, we will find out BP will be around 130 and 86, 88, or sometimes 90. So it has to be monitored, and so that we can advise the patient, don't be anxious and take diet restrictions and go for meditation so that the oxygen levels to the brain will increase. By that, the hypertension will come down. And restoring the vital force. What happens? We, as a homeopaths, the vital force is a broad term and broad word. But when we think of pathology, physiology, CRISPR medicine, drug discoveries, we will understand that vital force will give everything in general. And as a researcher, once the word vital force comes, I will understand what is genetics, what is CRISPR medicine, what is drug discovery, what is physiology, what is pathology, what is immunology, and what is neuromuscular development and neurological communications, what synaptic key will give. So these all things will come under one word, that is vital force. In those days, the whatever the experiments that were present during the Hahnemann time, he carried out every experiment. Had he seen the immunology and specialty immunology, see, the medical science is an ocean. One person can't do anything. So whatever he contributed, he has contributed much to his generation, and he has contributed for generations to come. So the vital force doesn't mean something that is a vague word or a philosophical word or something, a word that connect with the vital force means the total body physiological functions, and there will be abnormalities. What are the abnormalities? It is not the vital force abnormality. The pressure over the vessel walls is increasing, so the hypertension is going to become, patient is going to become hypertensive. So what is the disturbance in vital force? Maybe cholesterol is gaining, maybe his stress level habits, maybe his neuromuscular, neurological developments, maybe his thinking, maybe his habits, maybe he's doing unsocial things which are not justified by his conscience. So one has to understand the vital force derangement means the physiological, physical derangement, physiological changes in the body. So what is the approach? The holistic, patient-centered approach. One patient may require total diet restrictions. One patient may require suggestions. One patient may require compulsory exercise along with the medicines. And one patient may not require any medicine, and he will be taken on placebos for some time to observe whether he is really hypertensive or not. So this is known as CRISPR medicine, or this is known as personalized medicine in latest allopathic system of medicine. This is known as individualistic medicine in homeopathy, and every homeopathic doctor is well versed of this, and he will take the totality of the symptoms. After taking totality of the symptoms, he will understand the physiology, he will understand the pathology, he will apply the concepts of his organon to that particular patient, and he gives a constitution prescription by which the symptoms will come down. The symptoms are responding means there is a pathological change, a pathological revert should go, and when the reverse is coming, we have to see that the medicine has to work continuously and how to manage the patient for more times. And as a homeopathic doctors, we have to also understand and respect the concepts of the organon, the diseases which are curable, the diseases which are to be palliated, diseases which are to be managed. See, we have wonderful medicines to manage stroke, but we may not have risk of hypertension management or chronic kidney failure. So one has to understand A homeopathic doctor means a specialist in every system, and he is a cardiologist, he is a neurologist, he is the pharmacodynamics specialist, and he is a immunologist, he is a orthopedic doctor, and he is a gastroenterologist, he is a cardiologist. So without this knowledge, practicing homeopathy will be very easy even on symptomatic basis. But to assess the patient, to judge the patient, what are the judges? See, quality of life, longevity of life. These two things have to be managed on par with the technology that is being developed in modern system. So we have to always see survival of the fittest. So the homeopathic system will flourish. Already many homeopathic doctors are doing fantastic practices, but their system is not being recognized. It is not just because of the question of recognition. It is only the lack of expression of the work they are doing and lack of maintaining of the documents, which will make a researcher not to provide any research outcomes. So as a researcher, I have to do my clinical practice. I have to get the records. I have to see that. Then I have to apply my clinical practice into research. So it will be the toughest task. In allopathy, it is not like that. The research will be entirely different. The practitioner physician will be entirely different. The animal research will be entirely different. In homeopathy, they never give any opportunity to do like that. And at the same fashion, the homeopathic previously were not knowing that it will be thrown to a corner because of such outcomes. That otherwise, homeopathy is the latest medicine. When we are doing research, we are finding out the fantastic medicinal qualities, and which are where we found out some of the pathways we will see in our future slides. See, homeopathic causes of hypertension, suppressed emotions, grief, anger, anxiety. This is true, worry, because the sensory organs. See, hypertension will aggravate by seeing with eyes, hearing something, the extraordinary sounds, and sleeplessness, anger. Actually, the anger, grief, anxiety, they go hand in hand with hypertension. When the patient becomes hypertensive, his susceptibility towards infection will increase. He will not tolerate any more the infections that are present in the body. The infections need not come from outside the body. The first infection that comes is from the gut. The gut bacteria which are going to help, they in reverse, when the person becomes weak, when you call vital force, or when he is having hypertension, they will take advantage of the human being, because an animal is animal. See, sometimes when we maintain the balance immunologically, psychologically, emotionally, pathologically, physiologically, neurologically, then only the bacteria that is existing in our body will help us. But when we become little weak towards environment, the bacteria inside will make that is present in the gut. And first the symptom starts with indigestion, gases accumulation. These all will come around the age of the 40, flatus and belchings. So at the same time, the age of the 40 is the developmental stage of human life, where at the age of 40, he thinks of constructing house, purchasing car. He will become more responsible, and he will be the key person in the household to look after his parents as well as his kith and kin. So naturally, he will have a stress levels. Then if he do if small mistake will make him to enter into grief, and this grief will increase the hypertension, and the hypertension will increase the grief, because he will develop sleepless nights. So that concept, if we take into, see, this is the physiological concept, suppress emotions. The miasmatic, the pathological influences are psora, syphilis, psychosis. This is a concept which we use to arrange the disease, like carcinogenic, tubercular, malignant patient, carcinogenic patient, or tubercular patient, or orthopedic patient, surgical patient, medicinal patient, genetic patient, infertility patient. These are some of the qualifications and the concepts the homeopathy has developed. Sedentary lifestyle. When person enters into grief, naturally he will become slow and he never goes out. He will isolate himself. He will develop more and more grief. These all are because of the infections that are being carried out inside the body because the derangement of the vital force took place. The aging factor is coming out. The derangement of the vital force has given first the way to genes, and the genes are changing the DNA. According to the age, the disease is going to come up. When the disease is going to come up, he will give the symptoms. The symptoms are because of deranged physiology that is known as pathology. That pathology is being masked by the immunology and neurobiology. That neurobiology also being managed by vital force. This disease factors and disease causes also being managed by vital force. Vital force tries to manage the individual and make him and tries to keep him in balanced mood and in a balanced condition, but that never works. So it surrenders to the disease. When it surrenders to the disease, the infection rate in the body will increase. Because of the infection, the grief, the anger, the anxiety, three will increase. What is the infection? The simple pseudomonas, simple the bacteria, lactobacillus bacteria that is present, which will come from curd, also will disturb the, once you take curd in the night time, now it will not be accepted in the night time. See, if you take some fruits like orange or some citrus fruit, the people will not accept it after the 40 in the night time because the digesting them will be a tough task. Eating oily food in the night time, late night meals, now they will be going on avoiding because the system is going to surrender to the infection, that is the derangement of the vital force. And all these will have an important factor because the hereditary means, number one, hereditary doesn't mean only genetics. Hereditary means running in the families without DNA changes. Most of the patients will have family history of hypertension. But if we find out in DNA, the DNA will be free from the hypertension even at the age of 60. This is the hereditary factor. They will have hypertension above 140 and 90, but they will remain up to the age of 72 without any complication. Suddenly, he will die with myocardial infarction. So these are known as the hereditary factors or familial histories. And hereditary factor also include genetics. So when we find out some genetic changes, now the genetic markers are coming out, we can predict the disease. What is the disease one person is going to get at what age? And we can also prevent with our lifestyle modifications. And science no more requires any medicine. So such thing is coming, which is again a condition, a stage, or a concept of homeopathy. So common remedies we use. See, it's such a big hypertension, there will be so much of pathology. Knowing all the pathology is only to make patient very happy by the simplest drugs that are used in homeopathy. Cratagas. Cratagas is one of the medicine. See, why I took this medicine, why I haven't taken other medicines also, I will discuss here. Just for explanation, you people are highly experienced. You have given various medicines and controlling hypertension patients. You don't need any lectures or anything. But this is only a discussion. I think that I will learn more if I discuss with you, and whatever I know little, if I exchange with you, you will rectify me in my research. So Cratagas, what Cratagas is, it is known as a heart tonic. What it will do, it will maintain the heart muscle. The left ventricular hypertrophy is coming because of hypertension. So the left ventricular hypertrophy has to be controlled. The muscle has to come into the normal stage. The cardiac muscle should not be increased. The range of cardiac output should not be increased, means you have to control with medicine that will control the hypertension. When the hypertension is under control, you can give Cratagas as a medicine in low potencies so that it will control the infection and the left ventricular hypertrophy will come down. Raulgia serpentina is a remedy for nervous hypertension. Now, what is nervous hypertension? This is anxiety emotional. That is, only a systolic pressure will increase, but the diastolic pressure will be below 90. So in such conditions, a young person, he has to be cautious. So it will keep the balance and it will produce sleep. It will remove the sleeplessness. When sleep apnea is correct, the hypertension will come down, and you can create awareness about the hypertension, and you can manage the patient with Raulfia in low potencies, please. Why low potencies we are telling is the hypotension is as a researcher I am talking, not as a physician. We do not know what is the medicine it contains, so there will be always argument. When argument is present, we cannot carry out research in allopathic hospitals and on animals. So we have to take the medicine that where the medicine is present up to which quantity, and what is the medicine present, we have to see it clinically. So up to 12C potency we can see medicines. So up to 12C potency only will be tested. That's why you will find after Hahnemann, the Boric will give low potencies, and he was also very successful. So the glonine, we have taken up research for glonine. Natrum muriaticum, it is a common table salt. How it will control hypertension? Why it controls hypertension? There will be salt craving because there will be salt deprivation, and there will be excess salt that is being accumulated in the adipose tissue of the body. That's why there will be swelling of the lower limbs, swelling of the under the eyelids, so swelling of the face, and there will be headaches that are present, and headaches will increase if they go into the sunlight. The reason is the sodium deprivation. So sodium deprivation because of sodium accumulation. That sodium accumulation has to go means you have to give natrum mur. But one medicine cannot control simple the normal disorder, that is miasmatic disorder, or a disorder that is not cured by even in modern medicine, which can be controlled, needs a multi-dimensional approach. Suppose we have taken glonine study. What glonine do? Then the other medicines are laxis, arum metallicum, the initial stages of hypertension, sedentary life, stress, irritability, and digestive troubles. Naxwamica definitely will help, and it also maintains the sleep apnea. See, glonine. Glonine is known as nitroglycerin, enzymatically metabolized primarily by mitochondrial aldehyde dehydration. See, this is the homeopathic research which we have taken up. I have very little time, but I will complete within 2 minutes. So, this is what we have noticed in glonine. No means nitrous oxide, gaseous signaling molecule. When the nitrous oxide will enter, it will signal the immunological modulation. When it signals the immunological modulation will become into neuropsychological modulation. That neuropsychological modulation will come to vagus nerve, and vagus nerve will tell to the heart, control your hypertension. And whatever maybe it is idiopathic hypertension, primary hypertension, secondary hypertension, I am not worried. I will produce vasodilatation, and you have to listen to me. This is the effect of the glonine. So it diffuses into vascular smooth muscle cells. When it enters into the smooth muscle cells, it binds the hemomonitory soluble granulated secrets, that is SGC. This is known as HGC signaling. What is SGC? Then CGMP signaling. What is CGMP signaling? It is converts glynosine triphosphate into cyclic glynosine monophosphate. When triphosphate is present, it will cut and it will make it to monophosphatase, and that will be supplied to the immunological body, that will be supplied through leukocytes to the heart, and heart vasodilatation takes place, and protein kinase GPA elevation will come, and the blood pressure will come down, the headache will come down. This is the glonine action which we found out on parrots.
Rao sir, sorry to interrupt you. We have 2 minutes more remaining.
Yes, sir.
Yeah,
So
so you can proceed.
Yeah. This is most important, sir. See, this is our research outcome.
Yeah.
Homeopathic pathways were not understood, everybody says, but these are the pathways of homeopathic medicine. The mechanism of action of the homeopathic medicine is understood. So this is like that. So vasodilatory effect, venodilatation, veins also will dilate, arterial dilatation, all three will take place, and clinical application, if he comes, angina pectoris, myocardial infarction, hypertensive emergencies, heart failures, these all will come down with glonine, and if you take up. Now, what are the clinical indications? You know that these all are homeopathic part. Sudden congestion of the head, that will give headache because of hypertension. Throbbing, bursting, these are the symptoms. Fullness of the heat, these are all symptoms. Flushed out, red face, these all are the symptoms. Palpitations with anxiety, pulsating pains in the body, heat strokes, sunstrokes. Sunstroke, a person who is having hypertension only will be the victim of sunstrokes with a glonine. Glonine never cures the sunstroke directly without hypertension patients. So these are the aggravation factors, simple things which we have to take in homeopathic complication. Then other remedies which we have to compare as in compared with allopathy. See, belladonna also produces same type of symptoms. Natramur also produces headache. Sanguinaria also produces headaches. The difference between glonine and natramur is glonine is because of hypertension, that is myocardial infarction and increased diastolic value, whereas natramur is retention of sodium in the body. Sanguinaria and belladonna comes for inflammation. Sanguinaria is not at all suitable for hypertensive patients. So, glonine adder constitutions involving vascular congestion, acute circulation, deeper understanding, dual roads, bridge modern pharmacology and traditional homeopathy, and where if you give glonine, you will get successful results. And effectiveness of the treatment in chronic mild to moderate improves emotional health and blood pressure trends. Treatment is gradual and individualized. This one should not forget. Not suitable for hypertension in emergencies. I request with all homeopathic doctors, many gadgets are needed to maintain the risk factors and emergencies of hypertension like ketoacidosis, kidney failure, increase of creatinine and urea. These cases you should not take up in your consulting practice because it needs a patient to be admitted in hospital and to be treated. Kindly don't treat a patient with hypertension of more than 180 and 120. Don't take risk. See, nowadays the patient informed written consents are coming. We have to tell the patient and treat. And homeopathy can add in post-crisis recovery. When the hypertension comes, the stroke will come and there will be loss of movements. There will be paralytic effect. There will be a medicine known as aconite. The aconite pathways were also studied, but lack of time is making me not to present the pathways where aconite will act on the patients of. That's why aconite is the complementary to sulfur.
Sir, we are time bound. I'm very sorry.
Complementary to
So,
the BP monitoring. Okay, sir. These are the things. You have Crataegus, Rauwolfia, glonine, natramur, and this is the patients with conventional medicine. This is the graph. You kindly see the red graph is conventional, that is allopathy. The blue graph is homeopathy. That percentage of difference is only 5%. And except severe hypertension, where the homeopathic doctors will fail. So don't take up. After carrying out survey, we have came to these pictures. So please don't take up severe hypertension cases. Moderate, mild hypertension cases can be managed with homeopathy, and you can compete with allopathic doctors. Thank you. This
thank you,
is
sir.
case.
Thank you, sir, for your this
Yeah,
thing.
not so much.
Actually, this requires one more lecture. We will request you again to have one more lecture. Lot many questions are also there in the mind, but because of time bound, we have our Malayalam session waiting. In only a few 1 minute, I will request Ram Paresh sir to say the vote of thanks. Sir, kindly proceed with your thanks. I think there is a technical difficulty. Yeah.
Okay, sir. Thank you very much, sir. These all are for
Yeah,
my.
sir. On behalf of IFPH, I will say you lots of thanks. Your perspectives are very informative. There is a deep study. So, like, we would like to hear you again with some new presentations and some new cases also. So, shortly we can think for that, and you give us the opportunity. Now, can I request,
Sridharan
to
Kurup,
hand
sir.
over the
Namaskar, sir.
Namaste, sir. Can you hear us?
Sridharan Kurup is there. Just okay. Sir, namaskar after a long time.
Yeah. Sir, I will, now I will request our this thing speaker, and I will hand over this mic for our Malayalam session. So thank you for your presentation. It was really nice and very informative.
Kurup, sir. Namaskar. Okay, sir. Thank you very much, sir. Thank you. I will speak to you later, sir.
Thank you, sir.
Excellent. Very good.
Yeah.
Thank
Yes,
you
sir.
very much.
Thank you, sir.
Come again.
Yes, sir. Because of you only I am coming.
Yes, I
Here
know.
I say I don't come, Dhanesh will tell Sridhar and Kuru. So I will tell sir, I am obliging him. It is like
Okay.
that.
Thank you. Thank you very much.
Thank you, sir.
There is